Okay, so I'm going to be giving it Rosefin via IV feedback. The physician's orders read that I have to give 1 gram once a day to infuse every 1 hour, and I'm giving Rosefin as for its antibiotic effect for the UTI the patient has. And I have 500 milligrams per milliliter of Rosefin, so I'm going to give 2 milliliters. And I'm expected to watch for side effects of nausea, vomiting, shortness of breath, any unusual bleeding or bruising. I'm going to do the math. Drop factor is 10, so I have 8 drops per minute. And then I'm going to verify that I have Rosefin, 1 gram. I'm giving it IV via piggyback every 24 hours for 1 hour. I'm going to check the labs, the white blood cells are elevated, showing that the patient has an infection. I'm going to check to make sure that there's no allergies to this patient. So, and I checked the expiration date, and it's not expired, so we're good. So I'm going to go ahead and prepare the medicine.
Oh, sorry, I'm thinking piggyback. Sorry.
I'm going to first wash my hands, and I'm going to draw up, make sure again I have Rosefin, 2 ml.
For medications as well as alcohol. And I'm also going to note the time that I'm going to
And I'm going to read it. And discard that from the sharps.
well, I know I have to
Clean this board.
okay, we'll do it in the video.
Insert the bed.
Oh, yeah, it won't go all the way.
You just say it, we made the mark.
Yeah, you won't go all the way.
I'm going to recap and throw that in sharps. And then I'm going to label my bag. Rosefin 1 gram, added by, and put my name, date, and time. Then I'm going to do the patient's name. Just stick it in the bag. Then I am going to get this ready. Make sure that this is closed. Spike the bag. Great. Just like the ring. And I'm going to fill the chamber. I'm going to label label it with my name or my initials, the date, and the time. So that's ready. Next, alligator plant.
Now, what I'm going to look for with the company
And prime the line.
it's able to take the
I don't want to let too much go out because I don't want the medicine to go out. So now that that's ready, we are ready to go to the patient's room, and we're going to pretend this is a new alcohol wave. So I've got my MAR, take to the patient's room, go in, knock the door. I'm going to introduce myself. Hi, my name's Jessica. I'm here to give you your IV antibiotics. And can I get your name and date of birth? Perfect. And make sure you have no allergies. You're not allergic to anything? All right, perfect. So I'm going to wash my hands and apply gloves. I'm going to check the site for phlebitis or infiltration. I see no redness, swelling, nothing's leaking, so everything looks good. I'm going to make sure that the primary line is still running and it's open, and that's good. So now I'm going to, and I'm going to drop this one lower, the primary line lower.
I actually already see a
And then I'm going to new wipe, clean the board, make sure that this is still clamped. Wiped it. Then I'm going to open slowly. That's too fast. I have 8 drops per minute is what I calculated, so I'm going to calculate and count it. And that looks good, so I'm going to let it run. I make sure that the patient isn't feeling any pain, that there's nothing wrong with the site. I'm going to take my gloves off and leave the room. I'll come back periodically to check on the patient to make sure that everything's good, nothing wrong with the site, and then finally I'll come back in after it's done running, after the hour's up, right before the hour's up, and then I'll wash my hands again, I'll re-glove, I'll come in and I'll clamp the line off.
Let's practice outside. We can practice
And I will then disconnect from the primary line, make sure that's still running, never clamp that off, and I would pretend this is a new alligator clamp. So after I do the, going to take the primary line back up there,
And we're going to pretend that there is actually blood coming
make sure the rate's still set at the right time. I'm going to assess the site again, make sure that there's no vital filtration again, make sure that everything's still flowing properly. Ask the patient if they need any of their personal belongings, the call lights near, and make sure that everything's good with them still.
I'm going to
I'm
ask
going
for
to
it.
document, I would document the med administered, the dose and the route, the date and the time, and then the IV site, there was no swelling, redness, or any pain. And I would record the food volume and inputs and outputs, which would be 50 mLs because of the bag that ran it.
Everybody look.
And I would make sure everything was discarded and
And then I would